the positive and negative symptoms. The positive symptoms include hallucinations, delusions, inappropriate affect, disorganized speech and thoughts. And the negative symptoms include alogia, blunted or flat affect, and social withdrawal, and avolition. By this point, Ken was experiencing the auditory hallucinations, which are the most common type of hallucination that schizophrenics experience, and he was also experiencing delusions of grandeur, which are delusions where the person thinks that they are rich and famous or someone important, like a movie star. So he was suffering from that. And to receive a diagnosis of schizophrenia, the person must be suffering from 2 or more of the symptoms for a period of 1 month where the symptoms are active and affecting their life, and they're showing signs of deterioration in their social, occupational, or personal life. And the symptoms have to be pretty active for a month, and then they have to have some signs of the disorder for 6 months. And first they have to also rule out any other reasons for psychosis, which can be caused by intoxication. So once those are ruled out, and after 6 months, or if the symptoms are severe for a short amount of time, then they can receive a diagnosis of schizophrenia. As far as the prevalence of schizophrenia, it only affects about 1% of the world's population, so it's a relatively rare disease, and nowadays it's usually treated with these new atypical drugs, which have an effect on the positive as well as negative symptoms, whereas the conventional drugs only affected the positive symptoms. Ken started taking the new atypical drugs in the 90s. He'd been taking it for about a year before one day he noticed that his symptoms or his hallucinations were completely gone. He was probably more confused by that than when they had first come. He probably thought he was dreaming. He didn't tell his therapist right away. First he started missing the hallucinations because they had been with him for the past 32 years, so he'd kind of gotten used to them. But once he finally did tell his therapist, and he realized that the new atypical drugs were the reason that he had gotten rid of his hallucinations, that's when he really began his work as becoming a major voice in the mental health community. That's when he started setting up all these groups and the information service for people to call. Also with his treatment, he was seeing a therapist, which usually now, when you're given the atypical drugs, you also have therapy to go along with it, because usually they're more effective together than separate, and also the therapist can decide if the drug is helping at all or not. Also now, the prognosis of schizophrenia, most people can expect a full recovery in 10 years once they're diagnosed. Back then, I said earlier that prognosis wasn't good you basically had no hope of getting better, definitely no hope of leading a normal life, and all you had to look forward to were years in hospitals. So treatment has definitely come a long way. About 50% of schizophrenics take the new atypical drugs, and it helps about 85% of them, as opposed to the 65% that the conventional drugs help. So what Ken also lacked was any type of family support. So really, to make a full recovery, he probably could have done it a lot sooner had he had the support of his family, which in our book it talked about the developing countries compared to the developed countries. So, and they said that the developing countries, they had more family support and tended not to treat the people suffering from the mental disorders as outcasts, and they seemed to get better faster. So probably if Ken had had the support of his family, he might not have even committed suicide as often or attempted it. But suicide attempts are usually done about by 1/3 of people suffering from schizophrenia, and I think about 15% are successful, which luckily for Ken, he attempted it several times, but he was unsuccessful at each one. And then finally, he got the help he needed. He was able to overcome the disorder, and he gives hope to not only just people suffering from schizophrenia, but other people suffering from mental disorders. And he just gives them hope that they can someday get better.